bind to that particular messenger RNA and will form a double helical. So once a double helix is formed, that is a DNA-RNA hybrid is formed, so then no more protein would be synthesized that is corresponding to that part of the messenger RNA, and there will not be any disease. How do we come to know that whether it has better affinity or lesser affinity? We do it with a simple experiment, what we call as the melting temperature. But it's not the melting point, just we know the melting point of benzoic acid or something. It's melting, that means the temperature at which half of the DNA or half of the DNA RNA is uncoiled and other half is coiled. So that's a very simple UV melting experiment, what we call as. So that means now we are not targeting the protein, but we are targeting the messenger RNA. Now, what are the advantages? If we are able to develop some drugs on this platform, what will be the advantages? There are several advantages. First of all, the specificity, because we are targeting only the specific gene, and you know that our genomes can be different. There can be slight differences. So that means no two people will be prescribed the same medicine. You can have your own medicine for the same disease. I can have a different medicine for the same disease. So specificity, the applicability is very broad, because now we know that we can, by this methodology, we can treat some of the diseases which today we consider as incurable or undruggable. Then because now our building blocks are the same, ATGC, AUGC, nothing more than that, only 4 building blocks. So that means now we can have a more rational design, because it is only the order of those building blocks that need to be changed. ATGC can be a different drug and ACTT can be a different drug, depending upon whether it is targeting a particular gene or not. And because the building blocks are similar, so the safety profiles would also be sort of uniform. It will be much more efficient in terms of time as well as cost, especially at the early development stage. And because now there is only one kind of manufacturing that has to go with, so manufacturing can be automated, reducing the infrastructure investment. Now, as I am explaining, it looks like that maybe it is something rocket science, that it is as if something is started only yesterday. But that's not the case. If we go into the history of this platform, then the first proof of concept was given by Zemeckis and Stephenson way back in 1978. But the practice of this platform, or you can say the potential of this platform, is being harvested only after the sequencing of the entire human genome. And the first drug on this platform basically was approved by FDA by the name Bitravine in 1998, which is for AIDS-related cytomegalovirus retinitis. 2013, we saw another drug approved by FDA by the name Kinamero, which is for homozygous familial hypercholesterolemia. It's a disease in which the body keeps on continuously synthesizing cholesterol, and the longevity of the patient is very poor, even at the age of, say, 15 or 20 years. 2016, we had another drug, Exondys 51, for DMD, Duchenne muscular dystrophy. 2016, another drug in the same year by the brand name Spinraza for spinal muscular atrophy. Other than this, we had 2 more drugs approved by FDA with the name Onpattro, which is for hATTR amyloidosis. And in 2004, Macugen for the treatment of age-related macular degeneration. Many of my younger friends might be wondering what kind of diseases these are, why they are working on it. That can be a curious question, which I may be able to answer. I will be happy to answer if you have that curiosity. Now, how these drugs will look like? Many of you, especially the students of chemistry or students of science, they know how a paracetamol looks like or a diclofenac looks like. But the drugs of the future, which are based on short DNA, they'll just look like this. So this is Bitravine, which is a 21-mer, so it's a short DNA having 21 different nucleobases. And today there are more than 100 clinical trials all over the world, including phase 4, phase 3, phase 2 clinical trials. And then they are spread almost everywhere in the world, but mainly in, you see, the United States, Europe, Australia, and in those parts of the world. Now, what are the potential therapeutic applications? These are immense applications, especially you can see in those areas where today we say that there are no drugs: diabetes, cancer, apoptosis, lupus, inflammation, all those diseases which today we say that there are no diseases. So now, the idea looks very simple here, but there are certain challenges. First of all, we need to identify the proper gene target, what we want to target. We need to generate the oligonucleotide or DNA that is specific for the gene of interest. And whatever we make, they should be stable to the bodily enzymes like RNases and other nucleases. And drugs delivery has to be addressed. So with that, because of these reasons, because we need a stable duplex, we need nucleus resistant, we need cellular uptake, so we cannot use natural DNAs. So that means we need modified DNAs. And when it comes to modified DNAs, once again, I'm sorry, this is a mismatch of submersion, that's why it is flickering that much. So that means we need to use modified DNAs. And when it comes to modifications, in DNA there are 3 sites for modification: base, the backbone, and the sugar. And so many modifications have been done by all over the world, but we have also done many. I'll skip these slides for the paucity of time. My Google Scholar account is open, it's public, so you can just, if you have interest, you can go through the Google Scholar account for some of the publications based on that. So our interest was to decorate the major groove of the duplex. That means we know that the DNA has a major groove and the minor groove, so we want to target the major groove because a lot of chemistry can be done over there. We wanted to increase the stability of the helix. Helix, I'm talking about DNA-RNA helix, not the DNA-DNA helix, because we have identified the disease-causing gene on the messenger RNA. So whatever we develop should be nucleus stable, and most importantly, my modified DNA should not recognize a complementary DNA, but should target specifically the complementary mRNA, which is a big challenge. So with these interests in mind, we thought that, okay, we can increase the stability of the duplex by what we call as using double-headed nucleosides, the nucleotides with 2 heads by pi stacking. So our initial experiments were based on this modified molecule in which the normal nucleotide is having a triazole phenyl ring, which you can see at the top. You see the pointer will not work on the LED. So in this case, what is there at the top? You see there's a reference duplex. That means the reference which we want to target, and then a natural counterpart which is complementary to it, and it is written TM is 33.3 degrees Celsius. That means if I take the natural messenger RNA and I take a natural DNA which is complementary to it, so when it binds, it melts at 33.3 degrees Celsius. It is not the melting point like benzoic acid, as I said, the UV experiment. That means at 33.3 degrees Celsius, half of it will be coiled and half of it will be uncoiled. So if my modified DNA has a TM larger than 33.3, let us say 45 degrees, then my modified DNA will not let the natural DNA touch this messenger RNA and will selectively go and bind to the messenger RNA. That's the idea. And again, you see, that's what I explained. So we can have messenger RNA as a natural as well as modified DNA. So if the TM is higher, it will be stopping. It will not let the other natural DNA come near it, and will measure it by DNA. So with that idea, we thought of extending the scope of this. So we made 3 molecules. One is where you see the triazole phenyl. The second one is simple modification, putting a hydroxy group, triazole phenol, and finally the triazole benzene sulfonamide. So with these 3 molecules in hand, first of all, the synthesis is pretty straightforward for the DNA chemist. So we take the iodo 5 iodo-DU. First of all, protect the primary group with the DMT group. Then we do a Sono-Vishira coupling with TMS acetylene. And after that, you see TMS acetylene, we deprotect the TMS group by ammonia. And then we do the click chemistry. Everybody is doing click chemistry today. So we do the click chemistry, taking appropriate azides. So we get our triazole along with whatever we want to take to the major groove. After that, you see we phosphatidylate it because this is a procedure before we can take it to the automated DNA synthesizer. So once we have this molecule in hand, we take it to the automated DNA synthesizer and we make the desired modified DNA. For my younger friends who think that the DNA synthesis is something out of the Star Wars, it is not. It's a very pretty, sleek, simple machine, which is computer controlled. So you only give the sequence what you want to make. Only you put X where you want to introduce the modification, machine will stop there. You do the hand coupling, rest everything machine takes care on its own. So with these 3 molecules in hand, we started to think that we did the experiments to see what can we do. Can it recognize the particular messenger RNA without recognizing the DNA. So for studying, first of all, we studied the DNA duplexes. So at the bottom of the screen, you can see the target sequence is mentioned. If you are able to see, it is 5' D, G, C, A, A, C, A, C. That's the target sequence. This is the DNA sequence because, as I said, my drug should selectively identify messenger RNA and not the DNA. So first of all, if it is binding with the DNA, it's of no use to us. So first of all, we have to preclude it. So when we have this target sequence, which is the DNA, and we have a natural complementary DNA strand for it, a natural DNA, the melting temperature is 33 degrees Celsius. That means at 33 degrees Celsius, my natural DNA versus my targeted natural DNA, it is half coiled and half uncoiled. So on top of it, you see ON1, oligonucleotide 1, 2, 3, 4, and B is simply telling that I'm making how many modifications I'm making. That means I'm putting my X, Y, or Z, X, Y, or Z. So you can see that in the first row, now there is only one B. So when B is X as compared to 33 degrees Celsius, now my melting temperature is 28 degrees, 28.5 or 28. So that means when I introduce one of my modifications in the modified DNA, the DNA complex is destabilized because the melting temperature is less than 33. And we don't want it to stabilize because we don't want it to identify DNA. And when I have two or three incorporations, there is still destabilization. You see from 33 degree in the middle, you can see I went to 29. So 33 minus 29, 4 degree destabilization, but because there are two modifications, so 4 divided by 2, 2 degrees Celsius destabilization for each modification. And when I have 4 incorporations of X, Y, or Z, so now you see it is almost either the same or a little destabilized. So from 33, we went to 35.5, so increase of 2.5 divided by 4, roughly 0.6, 0.7 degrees stabilization, which is not a good stabilization. So that means the first part is passed about modified DNA does not recognize the complementary DNA to a great extent, rather it is destabilizing, that is good. Now coming to DNA RNA, when I have only one modification, now my target sequences RNA, 5' R, GCAAACAC. And unmodified reference duplex, that means natural messenger RNA, which I believe is responsible for synthesizing the disease-causing protein, with its complementary DNA. You know that the DNA has the AT and GC. You see that they are complementary to each other. So with the complementary, its melting temperature is 31 degrees. So when I have one modification, it destabilizes the DNA-RNA hybrid, DNA-RNA duplex, but the destabilization is less pronounced because it is ranging between minus 0.5 to 2 degrees. But you see, the moment I have two incorporations, now there is a significantly increased duplex stability. You can see that on the extreme right, when I have two modifications, from 31 I go to 39 degrees Celsius. That means 8 degree increase in stabilization because I have two modifications, so 8 divided by 2, 4 degrees Celsius per modification is the stabilization of my DNA-RNA hybrid. And when I have 3 or 4 incorporations, now there is a tremendous stabilization, something which was melting at 31 degrees Celsius, now it is going to 55.5. What does that simply means? That simply means that if I have a messenger RNA, which I believe is responsible for the synthesis of the disease-causing protein, I have a natural DNA in my body which can go and bind to it, and I have a modified DNA which I'm giving from outside. So my modified DNA, because its DNA RNA melting is 55.5 degree, it won't let the natural DNA come near the natural RNA. So there's a tremendous increase of over 24 degrees Celsius, but because there are 4 modifications, so 24 divided by 4, so stabilization of 6 degrees for each of the modification. That is remarkable. If I just try to see it from another perspective, the moment we go from 1 incorporation to 2, my melting increases from 30 to 39, so approximately 9 degrees Celsius stabilization by putting 1 more. In going from 2 to 3, you see there is an increase in stabilization of about 10 or 10.5 degrees Celsius. And in going from 3 to 4, again around 10 degree, that is 9.5 degrees Celsius increase. And that is remarkable RNA recognition as compared to DNA. That is what we wanted. That my modified DNA should not recognize the DNA, but it should recognize the messenger RNA. So based on this, we tried to see that why it is happening. So as usual, we went for molecular modeling, and we found that in the case of phenyl X or phenol Y, you see, if you can see there, that they are pointing away from each other, leading to destabilization, not as much stabilization as in case of Z or Z, what you say, in the end. So we can see that in the case of benzene sulfonamide, there is a perfect stacking. And these molecules, they were taken by the Ionis Pharmaceuticals. Ironically, their name was, throughout their life, it was ISIS Pharmaceuticals. For a pretty long time, ISIS Pharmaceuticals, Carlsbad, USA. Suddenly, a couple of years back, they realized that ISIS doesn't stimulate the right side of the brain. So they changed their name from ISIS Pharmaceuticals to Ionis Pharmaceuticals. So they took these molecules and they tried to test it in human Huntington patient fibroblasts. And what they found, because they tested it against the wild-type Huntington gene as well as the mutant Huntington gene, which is responsible for the Huntington disease, and they found that these molecules, these short DNAs, they are able to target 23 folds far better, 23 times more selectively the mutant Huntington patient fibroblast as compared to the wild type. So based on these results, they went to the transgenic mouse model, and there also they found that although the selectivity is that high for the mutant Huntington gene as compared to the wild type Huntington gene, but there is no apparent toxicity even after prolonged treatment in the transgenic mouse model. So what did I try to show in these two contrasts, starting from where we started as drugs and where we are heading for the drugs of the future? That number one, we are ready to see a paradigm shift in the drug discovery in the near future, where our drugs are expected to be DNA, RNA centric, and rather than those small molecule-based drugs. And the promise of this personalized medicine or antisense, anti-gene-based technologies, they appears to be stronger than ever. And I think that we are now more close to personalized medicine, where two of us go to the same doctor for the same disease, and two of us are getting a different drug as compared to a one-size-fits-all. And this rapid development of antisense technology, it offers almost unlimited scope for the development of new and highly specific therapeutics. Once considered incurables can be potentially cured in the near future. And the stacking of triazoles, that is, you see more from the perspective of, you can see the advanced learners in this field. But coming back to from where I started, what is in store for this region? Of course, you see the modern medicine appears to be fast progressing, but healthy living can be better achieved following a mix of the traditional medicine and lifestyle. Lifestyle is very important. You see, India is leading the way today, you see, with the International Day of Yoga or anything. But at the same time, many of these drugs which have been developed, they are derived from the traditional knowledge, going to the ethnic groups, looking at what they are doing, what they are eating, and then trying to figure out the active principle out of it. And that is where you see this region, which is a, you can say, hot biodiversity, very rich biodiversity spot. I think that comes very well. And I think it is high time that we study the traditional knowledge available with the traditional people, tribal people living close to nature, and test the claims on the modern parameters of medicine. So rather than shying away, moving away from the traditional medicine, I'm not saying that we should stop using allopathic medicine, but at best, as we say in the Indian system, allopathic medicine is at best as SOS. So if we can have you see, the prophylactic medicine, and prophylaxis is much more in the traditional way of living, in the traditional way of medicine as compared to the modern medicine. So coming back, the National Science Day 2023 theme, Global Science for Global Wellbeing, but what it can be for Bodoland. For Bodoland, I think that it can be the local science for global well-being. When I say local science, I'm not saying that the students of Bodoland should, should not embrace the global science, because science is the only religion which transcends all boundaries. But what I'm trying to say, while embracing the global science, I think that the science which we have at the local level, the knowledge that we have at the local level, the wisdom that we have at the local level, I think that we should use it, we should try to test it on the modern parameters, and we should use it for the global well-being. Only then we'll be able to say what we say, the Vasudhaiva Kutumbakam. That means the whole world is one, the whole world is just one family. So in the end, I thank each one of you for a patient hearing. And Mr. Chairperson, I didn't overshoot my time. I still have 1 minute, 23 seconds with me. And I'll be very happy to answer any of the queries from the audience. Thank you.
Okay, thank you, Professor Saman. Thank you for your illuminated talk. The session is now open. We can expect to at least 2-3 questions.
Good morning, sir. It was a wonderful lecture. So myself, Dr. Ananda Sogeri. Actually, my research area also fit whatever you have just discussed. I just wanted to know what is actually you are trying to do by changing that stabilizing energy, sir, because you are trying to increase the melting point. So how does it actually fit with our human physiology? Because our human physiology is working on 37 degrees C. So in that context, kindly highlight us.
Yes. I think that I should have been more upfront. What you are saying, you are very right that the physiological temperature is say 37, 38 degrees. So anything above it is a waste of energy, a waste of time. And nature works at the bodily temperature. Let me correct it by saying, what you are saying is the essay to figure out whether the affinity of a natural DNA to a natural RNA will be more, or the affinity of a modified DNA with the natural RNA will be more. So this is only an essay to check which DNA RNA hybrid will be more stable. So all these experiments, they are just on the normal temperature. So how to test which one is more stable? So we continuously keep on heating it in a UV experiment, and a temperature at which it is half of it is coiled and half of it is uncoiled. That temperature gives us an idea that which DNA will be having more affection for the natural messenger RNA. So the chemistry is not taking place at 55 degree or 60 degree or 45 degree. The chemistry is taking place the moment you put, I can put it in another way. Suppose you have a messenger RNA which we believe is responsible for the disease-causing protein. So you take a natural complementary DNA and you take a modified DNA and you mix them at room temperature. How would you determine, what forces will determine that which DNA will go and bind complementarily to messenger RNA? Those will be, you see, the supramolecular forces. But how to test where the supramolecular forces are more? So this is only an assay to test that which DNA would be binding at better. But the whole chemistry is at 37 degrees, if I'm able to explain that.
Okay, any more questions?
Anyone from the audience side, from the back? Middle?
See, I just mentioned the simplicity and curiosity, so maybe that...
Okay, sir, I have a very simple question.
Yeah,
of course, I am not a person from chemistry or biochemistry. My question may not be a question yet. But my point is that human DNA, what I remember, having a kind of size of about few gigabase pairs. So how do you select this particular part? What is the size you are targeting for the messenger RNA?
You see, that's what I said, that although this platform proof of concept was given in 1978, but you can see that other than 1998 with Ravine, all other drugs are after this 2000, 2005, 2010. You see, today, if you do a little bit of research, we have so many disease markers already identified because now we know the whole human genome. So the pictures that I showed are from the Times magazine, the cover page. And this is one way to look at that whether this is an in thing or not. The concept today is designer babies. What is designer babies? Although I personally do not subscribe to this idea of designer babies, it is only the overexpression and suppression of certain genes. Now that is too far, and I as a scientist do not subscribe to that. But your question, how do we identify? We identify from the genome. The genome is, you see, in USA, some companies are working on a $10 genome or $5 genome. So imagine that in 10 years, maybe that when you go to the doctor, he doesn't touch you, he doesn't talk to you. First he asks, okay, do you have your genome? So either it can be in a national database or it can be, let us say, in your pocket on a USB stick. Here is my genome and you can just look at it. So it is, of course, that is why, and one question which no one asks, why the drugs which have been approved are the drugs which common people don't ever listen about. Hypercholesterolemia, you see, hATTR amyloidosis. Why? Because this is such a revolutionary platform that the scientific community as well as the approving community, they want to treat a slow path. So they are approving drugs only against diseases, what we call as the orphan diseases. The diseases for which there is no hope. The diseases for which the number of people in the world are so limited that it is beyond the economics of the pharmaceutical companies. So that is why these 8 drugs which have been approved are the orphan drugs against the orphan diseases. So I hope that I could answer a little bit to your question. There are no more questions. I think that please.
Yes. Sir, we have one more question,
Yes,
sir.
yes, please.
It's not a question, sorry. Good morning, everyone. You just mentioned about designer babies and your personal opinion about not subscribing to that theory. Well, when we are talking about mankind coming up against more and more diseases, be it a lifestyle disease or be it a natural diseases, why not we can think about employing science to start something where the resistance to this type of diseases comes down? Talking about genome or genome testing, sequencing, whatever be, even today morning the news is there that India's richest person, Mukesh Ambani, is coming to the market with genome testing kits which are going to cost only rupees 12,000. That's less than maybe $1,000. Now, under that circumstance, what do you academicians, I'm a technocrat, what do academicians think about employing science for better genome employability for disease control and better lifestyle and health?
You see, thank you very much for your question, because that is addressing the larger perspective to humanity. I think that if you have noticed, that is why I deliberately mentioned that how the people from such regions contribute towards a better well-being. I said that the immune system talks more about prophylactic. होने से पहले, before you have a disease, if you can correct it. Unfortunately, allopathy doesn't touch that aspect. So what you are saying, many of the diseases, not all, many of the diseases are lifestyle diseases, right? And we can correct it by correcting the lifestyle. But at the same time, in this, you see, the mad rush to follow certain norms, we all are moving away from somewhere where you have to like do something from your hand, just popping up a pill in your mouth. So while I agree with you that more work should be on prophylactic on the lifestyle, and definitely we are doing a lot in terms of the yoga and other things. But at the same time, we must also treat forward with such designs, because all diseases are not lifestyle diseases. The genetic diseases, suppose due to any reason, let me agree with you that for a moment, suppose that all diseases are lifestyle diseases, but still those diseases which are in the gene now, which are transferring from, say, mother to baby or the father to baby or from the grandfather to the, those who we cannot correct it just by the lifestyle changes. So that is why you see what you say, I agree, but in this, the participation of the public, the awareness of the public holds a higher role as compared to the policy making. You are saying about 12,000. I'm saying that the genome project in the US, some companies want to work for $10 genome. That is where they are going. So both would go side by side, but people from this region, people living in such nice, wonderful areas where there is so much of the wisdom available, it's better to document it and to work on it, try to test it on the modern parameters. That's my simple take on it. So thank you very much for your patient hearing. Floor is yours. Thank you.
Thank you so much. So I think now we can go with the next session. So as per the proceeding, before we start, actually sorry, there are small changes in the program. So now we would like to facilitate our problem. So organizer, may I request will be coming forward.
Thank you. So we would like to felicitate Professor Pawan Kumar sir with a small appreciation of certificate.
Great. So how are you doing, everyone in this room? How many of you have a phone? Please flash me. 1, 2, 3, 4, 10, 12, 15. 15 are only there. 16. Okay. So 16, 17, 18, 22, 25. Not beyond 25. So where are the race? 28, 30. Everybody raise, please. Thank you so much. So I can see that we are here and you're flashing with me. So flash on me. Now in today morning, I think everyone has somewhere came in contact with water. How many of you have came in contact with water? Again, one more please. Only 3? I think something is wrong, I think I should speak in Tamil. How many? Only 3, 4, 10, 20? Oh, the rest come directly from the bed, I suppose. Anyhow, ladies and gentlemen, so today our team is here about the water. So how do you know what is your water? Here today we have an expert from Germany, and I'm very proud and privileged to inform one of our first speaker in this water team is Professor Krishik. So Professor Thomas Krishik, let me. Sorry, it's always happening. Yeah, perfect. Thank you so much. So here, Professor Thomas Krishik, as you can see here, he is a professor and head in water science department in the University of Applied Science Dresden in Germany. So he has already 28 years of experience in teaching and research, and more than half of my age. I mean, I have been not born that time. So moving to next, and he has got his PhD from the Technical University of Dresden, and his work is on the removal of iron, magnesium, and organic pollutant, where he has developed the protocol how to do the sampling of microplastic in sediment. So from here, if you can see, he has more than 28 international publication and 60 already acclaimed publication. From there, if I go on talking about his achievement, I think half of the day would be here in talking about it. So if you see here his experience in taking the project to the international level, where you can see some of the countries which I would like to mention here is Egypt, Russia, Thailand, Vietnam, Middle East, and of course, because of Islam in India since 2004, Professor Grisik has been working here. Now, based on this summary, if we can say that today we are going to understand about our water truly, how the water could be treated and how the water could be, make our friend. So to know your water, I would like to invite Professor Grisik over the stage, please.
So welcome, Professor Gisik. You will also have 40 minutes. Then after 40 minutes, we will have 10 minutes discussion.
The organizers, dear students, colleagues, friends, I'm very happy to be here and I thank for the invitation to be part of the Bodoland Knowledge Festival. And I'm of course not explaining what is water for you or what is the future of water. I'm just picking a very specific slot or specific technique for water supply. And there's one major similarity to my previous speaker, to Professor Sharma, to start with some philosophical idea. It's that we should look to be in the nature and to take advantage from what the nature can offer to us. So this is true for medicine and it's also true for water supply. So many people today think that reverse osmosis is a solution for our water problems. But reverse osmosis needs a lot of energy. And energy is also tricky for our world. So it means that we should look also on traditional things, like in the traditional medicine, we should also look on the experiences people made 100 years ago and what still works. And if it's a sustainable technique, which should not be skipped just due to some more technical innovations. So we can also try to optimize natural treatment techniques if we understand them better and we can take our advantage from it. That's why I would like to introduce the subject of riverbank filtration. And this is a picture from India. This is from Haridwar, from one of the major wells, which is used to supply water also to the pilgrims during the Kumbh Mela. And it's in the Ganga River. And so we see here that I would like to give you some basics on bank filtration, take you on a tour worldwide to see some sites, what has been done at other places in the world, coming back to India and give you a short summary perspective. If you look at riverbank filtration, it's just that you install a well at a certain distance to a surface water body. See, this is the you see on the left-hand side the well, and you abstract water, you induce a gradient, a hydraulic flow gradient, that the water is now introduced into the aquifer, so the river water infiltrates into the aquifer, and that's why we get so-called bank filtrate. So it's river water which has been passed through a certain part of the aquifer between the riverbank and the well. Of course, the water is not only infiltrating in the river at the river bank, but also at the center of the river, or even at the opposite side. But the phrase is riverbank filtration. You can also name it bank filtration or riverbank filtration or however, but it's all the same. It's a natural process of getting the water into the ground towards the wells. But on its way, it sees many different processes. So you see adsorption, you see biodegradation, mixing, precipitation. And all these processes are natural processes. It's just due to the contact of the water and the soluble compounds in the water with the clay minerals in the aquifer or with the bacteria which are sitting on the grains of your quartz sediments. So this is a natural process of cleaning also. And we also see, of course, a landside component. So very often we also pump a little bit of landside groundwater. What are the advantages of riverbank filtration? So we have, due to this flow passage through the aquifer, all the fluctuations in water quality and temperature, seasonal fluctuations you see in the river are balanced, are buffered. So because you have a mixing of different flow paths, different travel times towards your well, and so you get a much more stable water quality at your well, at your pump. You also see that you can remove suspended solids because it's acting like a huge filter. It's mainly already in the riverbed that the particles are removed. You get biodegradation of biodegradable compounds. You get absorption of absorbable compounds. You get a very nice removal of pathogens. And you have also removal of heavy metals, everything which is fixed to the sediments or is it's lipophilic or hydrophobic will be very well removed. Of course, there are some compounds, coming back to Professor Sharma, that the medicals, our modern medicals or pharmaceuticals sometimes are not that much degradable and not very well absorbable. So they may pass through. So it's not removing everything, but a very high number of compounds is removed during that natural passage. And the good thing is that you don't produce any waste, because if you give the nature time, it can decompose the substances. So you can have a degradation of organic material which would take maybe months or years, but it happens then if it's absorbed in that aquifer. So it's a low cost and natural treatment step. So we see bank filtration as an element of integrated water resources management. So we look at the system as a whole, and you can use it for pre-treatment of drinking water, of industrial water, even for irrigation to remove the pathogens. So it's the design of the bank filtration scheme is then based on the aim of your application. So if you go for drinking water, you may need a longer distance. If you go for irrigation water, you may put the well very near to the river. We also can try to decrease the over-abstraction in the aquifers. So you know from India, from China, that we have a depletion in groundwater in many places in the world. And so if we go to the rivers, especially during monsoon times, we can abstract the water from them, and so we can save the groundwater resources. It's also that we can dilute water which is affected by arsenic in some parts of India and Bengal, in Bangladesh, in Turkey. So we see that we have high arsenic concentrations, and by coupling it with groundwater abstraction and riverbank filtration, we may even lower down the arsenic concentrations in the drinking water. And it's also very robust against climate change, but I will not go into detail here. So why we can go for bank filtration instead of just putting the pump in the river itself. So you know some of these abstraction points in the rivers that we get from the river water when you have some conventional treatment, maybe with coagulation, flocculation, filtration, and disinfection. But you are suffering from high turbidity of rivers, from spills, from ineffective treatment. So it's not a very nice safety for the surface water. So you may be better on if you can go for bank filtration. It doesn't work everywhere. You need the appropriate hydrogeological conditions, but it's worth to think about. So we can also save costs for the treatment, and again, it's also adjusted natural mixing process in the aquifer. You have a huge buffer. If anything happens, you don't have to shut down your water works. If there's an oil spill on the Brahmaputra, you don't need to shut down your wells from the surface water extraction, because if it's bank filtration, you have so much time, and there's maybe less than 1% from that day that the oil was passing by. So it's not really affecting your water which you pump so much. Let's having a tour to see what happens in this field of riverbank filtration worldwide. Let us start in Europe, and I've indicated the countries we really have worked on because we have specialized on this subject. And so we see the dark blue countries where I would take you now on my tour, and there are some light blue countries we could also tell you something, but Of course, in nearly every country you find some examples for the application of this technology, but maybe to a very little extent only, to a little percentage. And this percentage may grow, and I will come back to that at the end of my talk. Let us start in Europe, and then we go to maybe Egypt, then we go take a ship to go to the South America, then to Northern America, then to Russia, Thailand, Korea, and then ending in India. Let us start in Europe. If you look at an overview picture for different techniques of managed active recharge, you see that the light blue bar, the lower bar, is induced bank filtration. So there are many sites in Europe, and the most of them you find in Germany. So I have seen that it works very well. So there are so many sites using bank filtration in Germany, but also in France and the Netherlands. It depends, of course, also on hydrogeology. But if you have alluvial deposits along your rivers, you are very well if you go for bank filtration. If you look at the sites, you see that it's quite a nice scattering of the dots here all over Europe. We have countries which rely to more than 50% on bank filtrate, for example, Hungary, Slovak Republic. In Germany, we have 16% of the total drinking water supply based on bank filtration. And there are, of course, some appropriate conditions. So you would like to have an aquifer which has a certain thickness. You would need some hydraulic conductivity that the water can really pass through to your well. You need, of course, the travel time, and these are typical conditions which you see in Europe. And you see also a portion of bank filtrate, it's between 20 and 100. So if you are on an island in the middle of a river, then you may even pump 100% river water because it comes from all sides, infiltrating into the ground, and then pumped up for the further treatment. If you look to go on a smaller scale, coming to my home state, to Saxony in Germany. So we have here one major river, which is the Elbe River, passing by to the city where we come from Dresden, the capital of this state. So you see these dark and light blue dots, and these are all the major riverbank filtration water companies or water works. So you see they are just putting along the major rivers, and so we pump the water not only for drinking water, but also for industrial water. And let's go into Dresden. There's one very old scheme. You see that it's also a type of tradition. Of course, there are much older traditions, but here you see it was built already in 1875. And within 1 year they completed it, so it was started in 1876. And so it was the first waterworks in Dresden. And so they just put a drain pipe along the riverbank. So you see the picture there, the old building still exists. Very nice engineering work. And you see the shafts, and the shafts have been connected with a drain pipe. And this drain pipe was in operation until 5 years ago. But then, of course, it's a very old one, so we had to replace it. And the water company decided to replace it by vertical wells. And this is now the modern style of construction of vertical wells. You see the drilling, you see the shaft construction because it should be flood protected. And then we have a nice new riverbank filtration site there at the old site. So they can use the same site still. So it's not that we have to replace or to move to another site. It's not that we overload the aquifer. So it's very sustainable. We have another larger waterworks which pumps about 50% of the whole supply of the city. And you see here some buildings, there are the filters and there are the aeration equipment, and you see the basins. But what you may not see from the back are the small white dots along the river. So we have just 100 meters away from the river, many wells in one row, they extract bank filtrate. Because we have just one piece of land, and we wanted to get more water, we also use the river water, pre-treat it and re-inject it into the aquifer within these basins. This is called artificial water recharge or managed active recharge. So we can get maybe 3 times more water from that size, from that area. So we have bank filtration and artificial recharge. And we have tested different types of innovative post-treatment techniques. For example, UV, you have ozonation, you can go for ultrafiltration, for reverse osmosis, for nanofiltration, for electrochlorination. But at the end, you see that you may remove a few more, maybe pharmaceuticals, better, but the major job is done already by the bank filtration, by the aquifer passage, and then the aeration, and maybe if you have a lot of industrial pollutants, activated carbon filtration. So the waterworks do not need all these fancy new techniques if they have a long passage in the natural aquifer. So it's a very efficient treatment step. And then let's go a bit more south to Egypt. Egypt has started bank filtration projects, and we have been involved in that. And they drill the wells very near to the river bank. And so they have some existing river bank filtration sites, but also some sites under development. And it's a very simple drilling technology, and they are happy because they have water which has less iron and manganese, because the river water doesn't have manganese. And so if you put a well very near to the river, you get a water which is free of pathogens, but it does not have so much manganese as the natural groundwater. And they also use it as beach sand filtration. So you put the well at the seashore, at the coastal line, and so if you just need to produce water using desalination plants, you may also use it as a pre-treatment to limit the clogging or the fouling of the membranes. So you save costs by using the natural treatment first and then going for ultrafiltration and reverse osmosis. So this is not far from Sharm el-Sheikh, and so they have just the wells placed in the coral sands on the beach, and they're happy to get a better water quality. Now we're passing the sea, we're going by ship to South America. Let's have a look to Brazil. There's a lake which has fresh water, and there's a sea which has saline water, and they are on this small spot there of land where we see the red dots, and they have a surface water treatment plant. But they have a lot of sludge, and they cannot still the sludge somewhere, and so they have smell from the sludge disposed there. And there's a beach, if people want to go for recreation, and they have this smell from the sludge. And so they have started to think about bank filtration to place something in the beach, so just below, people sitting there, and then you extract the fresh water from the subsurface, and you have a better removal of algae, and you have less sludge. And so it would also work very well, but you have to be careful that you don't suck the saline water. So it would be better to go as far away as possible from the sea. But this is in Florianopolis in Brazil. Let's go a bit more to the west, and this is Bolivia. So sometimes these schemes are very simple. So even if you have non-perennial rivers, you can take the time, if there is no flow or very low flow in the rivers, to put, for example, a cross-section in the riverbed, fill it with some sediments, with some gravel, put a pipe there, and then you have a shaft that is at the edge of your river, and then you can pump water from that drain pipe instead of taking the turbid water during the monsoon. This can be also done at large scale with more technical instrumentation, and this is in the US, so we go now north, and they put a drain pipe also in the bank of a larger river. So it's not necessarily that you have to use sophisticated wells. But of course, you can also go for horizontal collector wells, which is of course some experience and high modern equipment. So you see that they could put a very large shaft, and then they drill horizontal laterals below the river and to different directions, and they are able to extract a huge amount of water from it. It's not my preference because we have only a limited stretch in the river where you just suck the water from, So I would prefer to have more single wells on a long enough stretch at the river, because you may get clogging of a riverbed if you suck too much water due to this strong pressure difference. But you see the volume, they can pump 6,000 cubic meters an hour. So it's a huge amount from just one well. And that it's not only used in the US, it's also used in Hungary, for example, or in South Korea. South Korea is very famous for these small-scale collector wells, and they drilled it on an island, a perfect site for getting infiltrate. So you are safe, you just need to put the pipe to the land then, and they construct such collector wells with the laterals and pump a lot of water for their cities. If we go to Russia, so we pass the ocean again, just go more northern to the Amur River, which is a huge river also. And you see that there is a site where they have wells, and there's also a combination of subsurface treatment for iron manganese removal with riverbank filtration. So here they have a large city, Khabarovsk, which gets the water directly from the river, Amur. But they have very often spills, mainly from China, that they industrial pollutants, benzene, phenols, and so on. And it's quite cold in Khabarovsk, and so they have a thick ice top when in winter, and so there's no evaporation of these pollutants, and so they have a severe problem of smell and taste, and also, of course, toxicity of the water. And so they switch to bank filtration. And so let's see, if you pump from that spot, you introduce the water infiltrating, and this is during the flood, but normally the river is more away, so it's 1 to 2 kilometers away, but still you get the water from the river. And so you can produce much better water quality for your population. And it also works if you go for a very turbid river as seen in Thailand. So you see that there's a yellow river, there are many sediments also from gravel mining, and you would not expect that there's really an infiltration of that water, but it still works. And we also did some experiments with students. We put on a small temple there this facility to test the clogging effects, and we could calculate a certain abstraction rate which is feasible for that site, even if there is such a high turbidity in the river. So it still works. And of course, we are now coming to India last 20 years, and we have seen many sites, and we have tried to support our colleagues in Uttarakhand first, but also in other states in India. And also Professor Mendelssohn Rohan has been to Dresden, and so we are very happy that we can continue our cooperation with India. And so we have also Cornel Sandhu here. We will talk a bit more about some cases. I just mentioned it here briefly. So there's also we try to produce a map with bank filtration sites, but we see that less than 1% of the total water production in India is based on that natural treatment technique. And so sometimes in Europe we are a bit arrogant, so because we say, oh, the wastewater treatment in India is not that well, but we are not facing your problems. So if we would have the same growth in population, we would have the same problems, of course. So it's very hard to construct so quickly water treatment plants, sewage treatment plants. If you have finished one sewage treatment plant for a large city, maybe the population has already doubled. So this is really a challenge. And I acknowledge the activities of our Indian colleagues to try their best to do something, again, with the new mission to provide drinking water for every person in India. So it's a real challenge. And we think that we should not look also on the expensive treatment. We should go also for the natural treatment, starting from bank filtration for drinking water, but also looking at constructed wetlands or even waste treatment ponds, because this is natural, and you don't need always the high technical schemes. So just this example, which we will discuss in more detail by Cornel Sandhu then. This was our start as a demonstration well. in Harba on that island, perfect conditions, very good quality. We just need a little bit of disinfection for the network mainly, and we provide good water for the population of the city of Harba and also for the pilgrims. This is the island, but I will skip that. And we have also two types. The one was the large scale in Harba, and this is a small scale in Julu, in more north of Dehradun, in Uttarakhand. And even in such a stream where there's not much water flowing, but there is water flowing in the riverbed itself, you can put a small shaft well. It's very simple, and you see that there is something put into the ground during low flow, and this is just 2 meters below the riverbed. And you also have to protect it from the boulders which are running down there, the hills during the monsoon. And then you can get a better quality already. Less stability, less pathogens, but still something because it's a short flow path. But then you can take it by free gradient to your village, and then you may have, for example, on-site chlorination using something interesting, and it is a probe which produces chlorine from chloride, which is already naturally in your river water. So it means that you just need some solar energy, and you can produce chlorine without bringing the chemicals to your site. So it's autark, so it works also on site. You don't need to go there, and you can just produce from the chloride ions which are in your water typically, can produce a little bit of chlorine which is sufficient to disinfect your water. And this can be done, for example, at such small scale systems. And so we are running a project at the moment. It's also part of our visit here, and we also have a site in Guwahati. And so we are going to have, we have some demonstration sites in India for riverbank filtration, but also for other natural treatment techniques as constructed wetlands. And the aim is to promote riverbank filtration in India because we think there's much more potential and it is quickly to establish. So the vision is to work together to have more bank filtration sites in India to take advantage of its natural treatment techniques and to develop also a type of master plan or guideline. Not that easy because it's really depending on the local conditions, and to support also the consultants and industry to implement these things. And we are also trying to put more efforts into education and training for the students, for the engineers, to spread the idea. And we are going to organize a riverbank filtration conference in June, and we still hope that, of course, Professor Madison Orhan will be there, but we are inviting you also to join us. Keep it very informative there and at low cost also, and would like to bring the experts together working on bank filtration, water quality improvement, and also geophysics and hydrogeology related to bank filtration. Now, I would like to acknowledge the invitation from the organizers here at the festival, and also for the long-term cooperation with Professor Madison Orhan. I acknowledge the financial support from the German government. Maybe you have heard that the Chancellor from the German government, Olaf Scholz, has been in India 2 days ago, and he also declared that Germany has a strong interest to intensify the cooperation with India. So we are hopefully part of that, and we would like to continue the scientific cooperation with you, not only in Delhi or in Chennai, but also in the outcrops of the country. Thank you very much for your attention.
Thank you so much, Professor. So now I think we can have a few questions. I hope you are interested in meeting with our Aquaman. How many of there? Oh yes, please, sir.
Good morning, everyone. Sir, I have one simple question for you. As you know, our state, Assam, is affected by this arsenic contamination, particularly in the upper Assam districts like Golaghat and some other lower Assam districts also. Can we implement this riverbank filtration to those areas for removal of arsenic and fluoride? Fluoride is also there in our state.
So as you know, fluoride and arsenic are coming from the mineral, from the sediments. So if you put a groundwater well, you of course also may get fluoride and arsenic, and you cannot escape from that. It's everywhere, but it's different. You may even see pockets. You may get a site which is just 1 kilometer away, which has less. So depending on the composition of the subsurface. You know that in river water or lake water, you have more a higher portion of surface runoff and also from snow melt, so from other sources, which has little time to be in contact with these minerals. So there's less dissolution. So typically the surface water bodies contain less fluoride and less arsenic. Also, you'll sometimes see a precipitation of arsenic together with iron hydroxides in river beds. So if you would put the well near to the river, you may get a certain portion from river water, so maybe you get 50% less arsenic. And of course, you need to clean the aquifer between the river and the well, so it may take a while, may take some months or years to pump, and then the arsenic is slowly decreasing because we have already some arsenic in the aquifer. Because normally the river acts as a drain, so it gets the water from the groundwater. And now you reverse the flow direction, and now you have to clean the region between the well and the river. And then the best idea is to place the well quite near to the river to have a high percentage of bank rate and to have small reaction volume between the river and the well. But then you have, of course, also less removal of other pollutants. But maybe for the arsenic problem is helpful. The other option is to take direct surface water, but this is very often polluted and maybe turbid, and so you have more problems within the regular treatment.
Thank you so much. So anybody from the audience, few more questions to our egg comment? Anybody? So okay, so we have one more, sir.
What is your experience with the Indian projects that you have taken up, partly primarily in the Ganga Valley of Uttarakhand and others, regarding suitability of the water coming through riverbed filtration for drinking and household use purposes? Basically, how much more treatment is required after the riverbed filtration so that the water becomes perfectly suitable and drinking?
Yeah.
Your experience with Indian projects that have been taken.
So first, I have to say you cannot promise that you really get drinking water quality. It depends, of course, on the local conditions, and also you cannot give a rule of thumb for the best distance. Sometimes the distance should be very long to have the best removal of pollutants and of pathogens, for example. For pathogens, time is very important. For example, if you would like not only to remove bacteria, for bacteria even 10 days are fine. But for virus, it takes longer. And so for viruses, I would like to have 50 days or 100 days. But if you have 100 days, there are the other processes, like redox processes, and you may even get the solution of iron, manganese, and even arsenic. And so you may get other components in your water which are not in the river water. So it means that you have to define your major aim, and then you design your scheme according to your major aim. So there's not a really general, let's say, guideline. So you need the local people, you need the geologists, you need a water chemist, hopefully, or water engineering, and they have to work together to get an optimal place.
It has to be
On the other hand,
it has to be area specific. Area specific. That means
Yes,
the design
yes.
has to be area
it's
specific.
definitely area or site specific. Yeah. On the other hand, we are very happy to work in India because if somebody picks the idea from the companies, from the water authorities, they implemented in very short time. So because you have such pressure to provide drinking water. And in Germany, if you want to construct a new waterworks, it takes you 10 years. In India, it takes 1 year. So what we have seen. And so, of course, it's much faster. So this is for us wonderful.
Well, I thoroughly enjoyed your talk, but maybe that I'm naive in this area. My basic question is that how it is different than extracting water from the aquifer near to the any flowing river, because the water table otherwise would be high, and whatever we are getting in the aquifer would be filtered. That's my one question, which may be very naive from your perspective, but I still couldn't understand. Second thing is that you just mentioned that sometimes the bacteria is there, and depending upon the site, if the issue is only with bacteria, do we have this simply putting a UV treatment to the water? Does that help this bank filtration in any way? These are my two quick questions.
Yeah. So let me start with your last question. So if you, for example, get your bank filtrate, if you get your pumped water and you put a UV lamp, this is of course killing the bacteria, fine. But very often it's preferred to use chlorine because we have also problems in the network and distribution system. So UV acts only at the moment of application, but when you have no safety in the network, if there's any other pollution, it will affect also other people. So that's why we hesitate to apply UV. You can do it at the final point of use, but not maybe at the beginning of the network. The first question, so there's of course also natural occurring bank filtration, and sometimes people have unintentional use of bank filtration. That's why I said it's a very old technology, and it's not something innovative in a sense. It's just that you understand that you get the river water and that you take advantage from the quality of the river water. Because instead of taking it directly from the river, you can remove so many things, and instead of using the groundwater only, you may, for example, if you look at fluoride or arsenic, or if you just have too much groundwater abstraction, so you have decrease in the groundwater level. So then it makes sense to go nearer to the river, not to extract too much groundwater, which is formed by the natural recharge from the precipitation, but then you take advantage from the recharge from the river, which is also naturally occurring, contributing to the aquifer, of course. But if you take more, if you have the aim to take more from that part, then you keep the groundwater level high, and for, let's say, as a reserve, and also for these people which have to rely on groundwater sources.
Thank you so much, Professor Gershik. So if not the question, then I think we can move to the next proceeding. So as part of our next proceeding, to give a round of applause, everybody. Please raise your hand and give a round of applause, please. Thank you so much. Professor Gershik, so small kind of talking from our side. So I would like to request Professor Manohar Goswami, the Vice Chairman of today's session, to come over the stage and please hand over our certificate to the resource person. Please, हम तालियां बजते रहना चाहिए. धन्यवाद, बहुत धन्यवाद आपका. So now we'll go with the next proceeding. So as I hope and I believe that your meeting with our Aquaman was excellent. Now next come is Mr. Dr. Goblin. You know who is Dr. Goblin? Chemical man. It is Spider-Man. Have you seen Spider-Man? कितने लोगों ने Spider-Man देखा है? यार बहुत कम अंग्रेजी फिल्म देखते लगता है. चलो कोई बात नहीं, आज पता चल जाएगा डॉक्टर गॉब्लिन कौन है. So let me introduce. Yeah, so here Professor Helmut Bornik is a head of a research laboratory in Technical University Dresden. He is responsible for international and national projects, like for example in Brazil, India, Vietnam, South America, Africa, and so on. अगर इनके आप इतिहास देखा जाएगा तो आप गूगल करके देख लेना तो पता चल जाएगा कितनी है. मेरे पास कुछ लिस्ट है जो कि बहुत छोटी है टाइम की वजह से. Now next he has already lectured more than 25 lectures in various area like water analysis, water distribution, and water chemistry. अभी उनके बाद जो रिसर्च टॉपिक है डिसाइड जो कि अब जैसे मैंने आपको बताया था इट्स अबाउट ऑल वाटर साइंसेज एंड वाटर केमिस्ट्री तो आपको पता ही चल जाएगा व्हाट इट बी टॉकिंग अबाउट बट लेट मी गिव आउट ले आउट सम पॉइंट व्हाट इज दैट द एनालिसिस ऑफ ऑर्गेनिक पोल्यूटेंट अभी आपने कितनी लोगों ने चाय पिया कॉफी पिया तो मे बी वन ऑफ द आंसर व्हिच यू आर गोइंग टू फाइंड इन हियर फ्रॉम द लेक्चर ऑफ प्रोफेसर बॉडी so here you are going to find it here from the lecture of Professor Body. So here behavior of organic and micropollutant would be also this interest area, and next is the advantage of oxygen protocol, toxin, odor compound, and xenobacin and river bank filtration. Of course, excuse me for my pronunciation in chemistry. So over to you, sir. Thank you so much. Please round of applause, please.
Welcome, Dr. Boni. You will have 40 minutes and 10 minutes for discussion.
Yeah, ladies and gentlemen, it's a great honor and a pleasure for me to stay here and to give a presentation for more details about bank filtration. In this case, I will tell you more about the organic micropollutants, about the behavior. And I will start with a short introduction into these compounds of interest, and I will continue with the behavior, what we know, the general things about these compounds. I will shortly name it OMPs during bank filtration. And I will a little bit focus today on our studies in India, field studies, and some demonstration sites. I will show you the site situation, and also very short analytical procedure, and only some selected results. At the end, I will give short conclusion. Yes, besides other problems of water quality, we have heard from Professor Krishy, like germs problems or high salt concentration or nutrients or heavy metals. The anthropogenic organic micropollutants are of increasing concern. What are these compounds? We can divide these organic pollutants into two groups, generally as a classic pollutants. Typical is the polyaromatic hydrocarbons, the chloropesticides and some others, long time known and coming from industry often, and typical of these compounds, they are more or less non-polar and show high accumulation potential. The more or less new compounds, they're not really new. New is the knowledge about them because they are very polar as inertial pollutants. These polar compounds, it was a long time very difficult to analyze them because they have high affinity to water, and so the low concentration to analyze is very difficult because you need an enrichment and specific separation and detection of the compounds. What are the sources for these compounds? As you can see, this is a short water use cycle. The classic pollutants came mostly from industry or agriculture, but these emergent pollutants also came from household, from everyday use. Every time we use personal care products, we use medicines and some other products. And so that's a very important pathway of the compounds into the water cycle. As you can see here, the wastewater treatment plants play more or less a very important role. But if the compounds were not completely removed during wastewater treatment, then they can come into the waters, into the surface waters, the groundwater, and going back if they are used for the drinking water. Some examples for or typical examples for these emerging pollutants I've shown here. I will not go too much into detail. As you can see here, there are some very polar industrial chemicals like the naphthalene, sulfonates, perfluorinated compounds are highly interesting because they show also very toxic effects. Pesticides, as you know, but for example, glyphosate, very polar compound, or some antibiotics and other pharmaceutical compounds. What is typical with compounds? Besides the fact they are very polar and that's why very mobile. Another fact is that these compounds can occur in a large number of different compounds, and what is also very typical is the low concentrations, often in the nanogram per liter range in the natural water systems, and maybe sometimes also the microgram per liter range, but all in all, they are in a relative low concentration. Okay, now right back. Maybe something has changed. Size. The size has changed a little bit. Maybe it was okay. May I can continue. Doubling. But these compounds you can found all over the world. All polluted rivers were influenced by anthropogenic being, and these concentrations are low, I have told, and there are also problems that for all these compounds, for classic pollutants, we have more or less polar transformation products. Also, the knowledge of this is not high enough that we can understand it, all things. And next, I will show you a little bit about possibilities, how we can avoid the compounds, how we can eliminate the compounds from the source to the use. You cannot see here the good, but the whole way. Let us start with the wastewater treatment plants. Yes, the existing wastewater treatment plants, also in Europe, are not constructed to remove such compounds. They should eliminate the general organic loads and nutrients, but such micropollutants like pharmaceuticals can remove, but in some cases they were not removed or not completely removed. Okay, I should wait some moments. I can, maybe I will not need the whole 40 minutes. Maybe I will shorten. Okay. Best thing is to restart. Yes. Wow.
तो बड़े-बड़े प्रॉब्लम में छोटे-छोटे टेक्निकल ग्लिच तो होते रहती है। ओके। तो आपको अभी तक सेशन से तो मुझे ऐसा लग रहा है कि कम्युनिकेट कर पा रहा है। सही कह रहे हैं कि गलत कह रहे हैं मेरे नौजवानों? या तो आप लोगों ने कॉफी चाय नहीं पिया? दे रहना यार। You can have another 30-second coffee break. Only 30 seconds. I'm starting now.
The presentation is too long. But may I can continue with the heart of the graphs. I do my best to explain it for you. Okay. Here in this graph, drinking water treatment is a little bit missing, but I can explain. So what about wastewater treatment? This compound comes from our daily use, yeah, in the toilet and in the so into the wastewater treatment plants, the conventional biological treatment often not efficient, is not efficient enough, and so in some European countries, we are thinking about to enlarge this treatment. After biological step, we do some activated carbon or some ozonation to remove these trace micropollutants, organic micropollutants. And yes, but it's expensive, of course. Yes, it's why in the moment certain amount of compounds entering into the environment, also in the environment, something happens. Yes, also these compounds can be removed. In the rivers, we have UV sunlight, we have chemical degradation of the compounds. We can also have biological elimination. But these processes in the environment are very long, not to control for us, and also very bad for the ecosystems. That's why, looking at the drinking water treatment, this is part I will talk later a little bit, but the concentrations are very low, and I think it's not effective to remove the compounds at the end of the pipe. That's not a good solution for the future. That's why more sustainable aspects should be to create new agents which are greener, which are better biodegradable. For example, for the epileptic medicines we use in Europe, often carbamazepine. It's very stable. You found it also in all different stages of the water cycle. But we have now gabapentin. It's a new compound. This is same positive effect for human, but it's better biodegradable. That's an example, but we can also use, as the first lecture was explained by Professor Sharma, we can use DNA approaches, but it's a long way to do it, yes? And it needs also the cooperation with the existing pharmaceutical industry. Another point is for more sustainable aspects are the avoidance of the release of compounds. So we need a conscious handling of the chemicals and also some technical improvement also in industry, yes, to work with closed water cycles. Only to show, it's a little bit pity that you cannot see the whole graph, but as you can see here is an example for our own investigations in Germany. We can show that a high number of compounds can be removed during wastewater treatment. We see here a scheme of wastewater treatment plants. We had a long time analysis of the input and the output of a wastewater treatment plant on more than one, I think 3 or 4 different treatment plants. It analyzes the compounds of interest, yes, pharmaceuticals, some pesticides, also industrial chemicals, personal care products, and so on. And we also investigate or we analyze the concentrations of the residing river. Yeah. And as you can see, the green arrows found a very, very good elimination during this treatment. For some compounds, in orange, it's more moderate, and the red arrows show it's more or less very low efficiency. For 2 compounds, you can see also negative values. This is due to the fact that there are some reconjugation of metabolites. Yes, we can explain it. And what you can see here, it's a pity you cannot see, is this ibuprofen. It's an anti-pain agent, and it's normally a very good removal during wastewater treatment plant. But what you can see is a high input concentration. it's higher than 12,000 nanogram per liter. This means 12 microgram per liter. It's of course low concentration, but it's high enough to show some effects also in the ecosystem. And what you can see here, it's a very low output in comparison to the input, but it is something. It's about 500 to 1,000 nanogram per liter, and this we will found in the rivers. So now let's have a look on the drinking water treatment. The conventional methods, flocculation, also sand filtration doesn't work for such polar and more or less stable compounds, which are not removed during wastewater treatment. We have some other techniques like the oxidation processes, the membrane techniques, absorption, but it needs costs and high effort. And also we have always some disadvantages. For example, during the oscillation, we have formation of transformation byproducts. Nobody knows, or we know a little bit more, but we have not full information about their behavior and also of their effects. So the last step is bank filtration, and this is the point I will now a little bit more demonstrate for you. Okay, bank filtration, I will not explain anything more. What the BIKF has shown in this presentation before, but for these organic microorganisms, the most important process are biodegradation and absorption. If you have a stable compound which can be absorbed in the aquifer region, then you have very long residence time, and the chance that something happens chemical way or biological way is very high. And of course, you have always possible mixing effects with groundwater. So the problem is, if we want to investigate some specific compounds, the number of compounds is so high. Yes? Would be a nice question for all of you. How many chemicals are known? It was in October 2022 about 200 million compounds existing. Yes? But not all these compounds were used or have any importance in case of production. There's a number of 134,000 have a certain relevance, and of course not all these compounds are interesting as an environmental relevant compound. Another number only is in Germany, we have about 3,000 active pharmaceutical ingredients. So it's very difficult to analyze all of that. It's not possible. That's why we always look for these compounds which show low biodegradation. Yes, if we have a good biodegradation, we have to look, of course, after primary transformation, we have any transformation products we look for, and what about absorption? The most important compounds in view of our drinking water are compounds which are very stable, cannot be degraded, and which have high polarity. Means they are very polar. In a high number of investigation of researchers and also in combination with practicals, we have field studies, and during the field study we can get a first answer, but additionally we need lab experiments, yes, to explain the behavior, to verify the behavior of the compounds in the environment or in the bank filtration method, and we combine it with models. Today I will a bit focus on our field studies, and yes, we know it from Germany, from studies, from own studies, from studies of others, also from Europe and the US and also other countries, that or during bank filtration, most of the compounds of interest can be removed. Yeah? And of course, there are some compounds in the middle. There are X-ray contrast media, which are more or less stable also after bank filtration. And in the end, the question is, can we transfer such results, if we know it, a little bit more in a moment about compounds, about the behavior. Can we transfer these results to other regions, to other conditions, climate conditions, to other water matrices, and also to other sediment systems? Yes? That's why we are looking in, also in countries like India and to work together with our partners in here. So we have a nice project at the moment, also project note in this presentation about the ongoing project. We have on more than 5 sites here, the main sites, which have different characterization and kind of pollutants, potentially occurring pollutants coming from urban regions, from industry, agriculture, or mining. Yes, it's pointer doesn't work, but you can see it's divided a little bit more in the north, to the east, but also in the south. And sorry, I was afraid.
So our technician is trying to solve the problem. Let's say maybe another 32 seconds, 2 more seconds he can fix it. Meanwhile, I think I would like to know from all the participants, 50% of your water has been known, I think, up to now. क्या मैं सही हूँ या गलत? How many of you can say that I'm right? That I know about, you know that you know your water. Oh, perfect. See, I think we know his machine. Thank you so much. So I think we can start. Rodney in perfect. So over to you. What's the body? Yeah, done. Thank you so much.
Very nice. Looks very nice. Many thanks. Thank you. Yeah. So, these are the sites of investigation. At the moment, we are the second phase now, and we're finalizing this project next year, but hopefully we continue. But very short aspects to the analytical methods. After the sampling, we have to transport these compounds to our laboratories. There's no enrichment necessary because we have a very sensitive system. We can analyze the compounds directly with a high sensitive mass spectrometer. This is the center of this picture here. To get the data. And yeah, the very important thing is that we have to look for the sampling. Most of the errors we do during the sampling, maybe, for example, you can contaminate the sample. Case you have some antiphage in the morning, or you have some insecticides because of the mosquitoes. We will find high concentration, and that's why we should be very careful. So we have also analyzed the general quality aspect, but this is not the topic of my presentation. I will concentrate of the organic micropollutants, and next step I can show you during our 6 campaigns we have realized after Corona time highest concentration of the compound. It's in the looks high, but the concentrations are really comparable with the compound concentration in the rivers in Europe. So we are a little bit, from the beginning, we thought that the very polluted rivers like Yamna and so on, they had higher concentrations, but maybe we had higher concentrations here in comparison to Europe. We had more sunlight, something happened. Yes, also a river is like a reactor, and compounds can be degraded, for example. But as you can see here, some of the typical pharmaceutical compounds are high enough that we can analyze in a higher concentration. And then the question is, what's happened now with this concentration, with this compound during bank filtration? And here's a nice site we have here in Agra, a site we investigate in the river, same time in the well, and also we have information about possible concentration in groundwater, but we have found because groundwater is free of such compounds. So we can see here the decrease. The decrease for some of the compounds are nearly 100% or are 100%, but for other compounds like carbamazepine, which is known, it's very stable. It's also degradation of the concentration, maybe also in the case of due to the dilution with groundwater. Next slide, you can see some concentrations in these 3 points: river, well, and groundwater. For further compounds, as you can see here, again, the very nice effect of bank filtration can have a strong decrease of the concentration. That means you have a good attenuation of these problematical compounds which cannot be completely removed during wastewater treatment. Yes? And of course, we have also diffuse sources, but more or less they came from the wastewater treatment plants or from the household. Another example is in Gagara, another site. It also can show a good effect for most of the compounds, complete elimination or decrease. Only for some compounds, the copy is very high. It would be, you cannot see the other concentration. It's around 2,000 micrograms per liter, but carbamazepine is for us more a trace of antigenic being. Yes, that's another example. We have measured the concentration in the Ganga River, in Varanasi. Yes, up to now no bank filtration site, but there are constructed wetlands under construction at the moment. And as you can see here, different concentration of the compounds show us that there's a strong influence of the tributaries. And one of the tributaries will show very high concentration. There we will stop these pollutions, or we will decrease the pollution to this construction of this construction of these special wetlands. Is a very nice possibility for elimination of such micropollutants. But the processes in the constructed wetlands and also in other groundwater recharge are nearly the same in bank filtration. We have biophilic absorption and also dilution effects. So all in all, I can summarize the results of our investigations a little bit. As you can see here, for most of the investigated compounds, we always have to look for a targeted number, for a limited number of compounds are very good. Only for compounds like carbamazepine or some other pharmaceuticals, or DET is the index side, we have not such a good removal. That should be also known. We have always also a certain limitation, also depending from the site. So we cannot in every case transfer these results from one side to another one. But generally, very good effects. So to verify these results and also to make an assumption or make a pre-calculation of the behavior of other compounds, we have many tools in laboratories. I will only show you 2 examples to bring the field into the lab. Here, for example, we use biologically active filters which are adapted in a certain river. In this case, we use the river in my hometown, Elbe water. And as you can see in the center, that for most of the UV blockers are very good degradation. In such a system, we add compounds of interest and taking samples after a certain time. The microorganisms in the system, which are nearly the same as the first centimeters of the bank filtration, they can degrade such compounds. The second graph on the right side, you can see that compounds can be degraded, like coffee even and other compounds, but other are stable. Yes? So here we can really systematically investigate the influence of pH, of the ion strength, of the organic background, of temperature, and so on. These are very nice tools to explain our results in the field. Furthermore, we have also column experiments to investigate the breakthrough behavior of the compounds, as you can see here for some compounds. Or we can also make biological active columns and abiotic columns, adding up some biocides. And so we can compare. I will only show you that we are in good comparison with the field experiments for the compounds against these antibioticum carbamazepine show very bad removal. Yes, it's very stable. And other compounds like benzophenone will show very good removal. And also some compounds show a certain removal, but these are very sensitive, and particularly such compounds, the removal of such compounds are very strongly influenced by the boundary condition of the sun. Okay, let me come to the conclusion, some of the conclusions. So what we can see is that the concentration in the Indian rivers are nearly the same, sometimes lower, sometimes a little higher, depending on the compounds and on the sites in comparison to European rivers. Also, the type are similar, but sometimes the differ in the concentration which are occurring. What we have seen from our 40 compounds selections, that half of the compounds could be found in the Indian water bodies up to now. And I think we have seen that there was a good attenuation of these organic micropollutants. In the future, what we will need, we will have to look more at the influence of the bank filtration, of the climate change, also in the rivers, but also during bank filtration. Look so that bank filtration is a stable component also in view of changing climate conditions. We have to expand this compounds selection up to now 40. We have now more than 100 compounds, and we will have more non-target screening to also have a look of unknown compounds in the future. And yeah, in the end, also exploring the zero bank filtration in the case of extremely contaminated river waters. Also, maybe there's some sites not possible yet a very strong pollutant, and maybe we can say the concentration of the compounds are too high. Look for another source or another field. Okay, then at the end, my presentation a little bit interrupted. Sorry for it. I want to give my thanks to all our partners and also for you. Okay, thank you.
Thank you, Professor Bowling. The session is now open for discussion. Any questions from the audience side?
Excuse me, sir. I have a simple observation. Observation is that in our Hindu mythology, the river Ganges is, it has been taken as one of the sacred rivers. So if we keep the Ganges water in our house after 1 year or so, and if we keep the river water from other sources, other rivers, but the Ganges river does not contaminate. is it a myth or whatever your study shows that is whether, I mean, that is from the upstream of the Ganges, I mean, in Haridwar or you may be in Gomukh and Gangotri, if you collect the water and you keep it in your house for a long time, then those type of algae or otherwise the biocontaminant or maybe other contaminant because of the environmental reason that does not make such influence on Ganges river than in comparison to other rivers.
You have a storage of your water after a certain treatment. You have any treatment of it?
No treatment. We are keeping it as it is in our house. It's a long belief of the Hindus. I mean, but it seems that means it is in certain respect it is correct also, that assumption. So I would because you are doing the research for that matter, that means though we say Ganges is contaminated in most of the industrial wastes gone there, or there are some projects are there to clean the Ganges, but is there any something special in the river Ganges in comparison to the other river? That is my question.
I think in every case the problem is are the microorganisms. Yes, after storage you have a growing of this organism, also germs and so on. I think it's not a topic for these organic micropollutants. A long time storage, every case may be a problem. Also at higher temperatures, and I would not have a storage. Also in case of a treatment, yes. Also you can have an contamination with some microorganisms when you have growing, and then I think there's no difference to other rivers. I would not assume. Ganga River and Yamuna River, and also Elbe River, I would not have storage and drink it up for a longer time or use it for other purposes, depending what you want to do.
Very good lecture, sir. Actually, I am from biosciences, so I have no such big experience in analyzing in water and all. Actually, my question is very basic to our lab structures, because we are working on different pesticides sometimes different pharmaceutical drugs we use, and generally we simply washing in our basins, and we simply just keep it outlet will be there. But is there any facility which can filter such kind of washouts? Say, for example, pesticide we simply wash out the glasswares and all. So this water is simply going inside the soils. So is there any such facility which, before reaching the water, that kind of water can be filtered, so that water do not get contaminated? That is my simple question, sir.
You mean you have a storage of water or the tank? Or
No, sir. Before reaching the soil, how can we treat such kind of pesticide waters?
The best way is activated carbon to remove it. I think activated carbon helps also for polar compounds, but the efficiency is not high enough because you have a very early breakthrough if you use an activated carbon filter. Okay. That's why we always promising the back preparation. If it's possible in your case, if you use an amalgam, you can also bring your water into the ground. But if you have a very limited number of water, then you can use these.
Sir, in our case, sir, we just use it and wash it in our machines and all. Then all those chemicals used to go and into the soil. They are simply released into the soils. So how to filter such kind of laboratory
you mean for pesticides, particularly for pesticides?
Pesticides, sometimes the pharmaceutical drugs also we use.
A normal sample will not so help. If you have a long time residence time, maybe there's also biofilm you can use and produce it. But I would prefer other techniques which are more costly. Activated chem, I suppose, oxidation processes are available, but they all need higher cost and energy. At the end, also membrane techniques will work, but it's really high cost energy.
Thank you, sir. Sir, any simple suggestions, sir, for such kind of filtration? Okay, thank you.
It's very good. Depending if they are non-polar compounds, it's easier than for polar compounds. For glyphosate, it's very difficult to remove. It's highly polar. And then it will go through our filters. Without, if you have activated compounds, it will help.
Hello, sir.
Hello.
One simple question. In our region, particularly this northeastern region of India, the pesticide contamination takes place due to agricultural activity. Because this region is industrially backward, so main source of pesticides is agricultural activity. And from these sources, generally surface water is contaminated and the soil also gets contaminated. So, in this respect, your riverbank filtration will be that means suitable for this. That means removal of pesticides from water or not? This is the first question. And since the soil gets contaminated, how it will act?
The first question, you mean also against the question of pesticides, how you can remove or yeah, I can show you that the pesticides removal is very nice and very efficiently. Also for diuron, we have 500,000 nanogram per liter diuron in some of the rivers in India, and we have never found diuron in the wells. So for most of the pesticides, I think back filtration is a good method to remove them. Yes? But in every case, I would have a control. Yeah? You should look in the water and in the wells and compare. Maybe you have some specific pesticides you have not on our list now. Then it would be highly interesting to have a look on it. How is the efficiency? Maybe in future we can help you with it. Also, I know that also in India the laboratories are more and more very powerful. We get new instruments, and also the possibility of such analysis can be realized in India.
Okay. Thank you, sir.
We can work together.
Okay, so I'll take a last question. So we'll proceed for sorry, there was a confusion. I think you know that. So anybody from this side, one last question? If not, then I think we should proceed to the next. So thank you so much, Mr. Bhoni, for giving a talk on. Okay.
For the point, just one question. I have seen in your slide, you put BP as one of the main organic pollutant. BP. Is it a biological particle or bacterial particle or what?
DET, yeah?
No, BP. BP. BP.
Yeah. Benzophenols.
Also, phenol.
These are the UV filter. We are investigated very intensively because also in Germany,
Okay.
there's not enough knowledge about their behavior and also about the effects. So we have on our 3 articles about it. Yeah.
So this is special for India or even in Europe also you get it?
We found these compounds all over the world. We use it everywhere. Also, it's a problem for the sea because of the organism in the sea. It's dangerous. Yeah?
But how UV works there? How UV works there? In degradation, how ultraviolet works there? Ultraviolet filter you have shown.
You have it in a sun cream, for example, but also in a lot of materials to protect the materials against sunlight. So you found it everywhere. Also, we found it in plastics, emission from plastics. So it's really a problem.
Thank you.
But we have looked for 9 different compounds. We found always 3 all over the world.
Great, so thank you so much for answering. So now I would like to request a round of applause, please. Tell you. Thank you. So now I would like to request the organizer to come forward, and also I would like to request the chairperson of today's program, Harimbo Baru, to come over the stage right over here and hand over the certificate to सबसे बॉन्ड राउंड ऑफ अप्लॉज प्लीज तालियों से रहना चाहिए जी बहुत बहुत धन्यवाद हमारा इस सेशन के आखिरी स्पीकर है डॉक्टर कॉर्नेलियस संधू कॉर्नेलियस मेरा बड़ा भाई है तो मैं इंट्रोडक्शन नहीं दूंगा बड़ा भाई छोटा भाई नहीं देता है लेकिन तो फॉर those who don't know Dr. Cornelius Sandhu, so I'd like to inform that Dr. Cornelius Sandhu is a senior researcher at University of Applied Science Dresden. हमने साथ में PhD की है तो हम मैं लिबर्टी ले सकता हूँ मुझे मजाक करने के लिए थोड़ा खींचने के लिए ये बहुत खतरनाक है लेकिन बहुत डांटते हैं तो आप लोग अगर सेशन अच्छे से नहीं सुनेंगे तो फिर हो सकता है आपको डांट देंगे तो नाउ लेट मी गो प्रोसीडिंग टू द नेक्स्ट तो उन्होंने अभी 6 और 32 साइंटिफिक जर्नल को ऑथर किया हुआ है जिसके आरबीएस पे इन्हें 2004 से इंडिया पे काम किया हुआ है तो डॉक्टर कॉर्नेलियस मैं आपको आमंत्रित करना चाहता हूं स्टेज पे और डॉक्टर कॉर्नेलियस रिस्पांसिबल इंडो जर्मन कोलैबोरेशन हियर तो राउंड ऑफ अप्लॉज प्लीज
So welcome, Dr. Sandhu. And you have 40 minutes and 10 minutes for discussion.
Thank you very much. Namaskar to everybody. And thank you, Dr. Rongang, and also to the hosts, to BIKF, to Bodoland University, to the organizers also for the privilege they have given me to be here and to speak today. And of course, thank you, Medelson. I don't deserve so much credit like you mentioned, but nevertheless, thank you. So today I will, we started a bit from Bodoland, from Assam, the northeast, and we went worldwide around, we took a tour, and now slowly I'll come back to India, to North India, and from there lastly I'll come to Assam, and I'll conclude here in Assam. So, I'd also like to thank all my co-authors and also Dr. Rongang, because Dr. Rongang is also part of our team and he's also done a lot of work near Guwahati and also at some sites in Uttarakhand. And so I will just introduce the topic a bit and talk about riverbank filtration, some of the sites that have been developed in Uttarakhand, and some new developments that have been demonstrated, and also lastly a demonstration project which is currently going on in near Guwahati. So Dr. Krishak had introduced what is riverbank filtration, and he also mentioned it's an element of managed aquifer recharge. So what is managed aquifer recharge? To the audience, how many amongst the younger generation have heard of managed aquifer recharge? Can someone raise their hands, please? Managed aquifer recharge? How many have heard of artificial recharge? You must have heard of artificial recharge, I think it's not a new term, but nevertheless, there is a lot of potential. If you see, there's in Asia especially, and we are a part of Asia, and to this big number here, which you see on the upper graph, India contributes a very large chunk to that, and that is something very positive. But if you look at the lower part, the percentage of the groundwater which is contributed by the which is used is actually relatively low, and so mainly this is because a lot of the schemes in India are artificial recharge schemes, and they differ from managed aquifer recharge mainly because the quality aspect is not so much considered. It's mostly quantity. It's a lot of volume which is recharged, that is good, but the quality aspects are not always considered in such detail as they should actually be. So, and if we see here, it's a very positive picture. So over the years, artificial recharge capacity in India has increased. But if you look at the whole picture, that also includes managed aquifer recharge. The term managed, it does not take into account so much the quality. So with that, we come to this map here, which has already been shown. And of course, we see that there are many sites in India, especially in the north, but also in the coastal regions. We also have some sites in south central India, in Jharkhand and West Bengal. And we see that they're mainly in the gray shaded areas, which are the alluvial aquifers. So, of course, in the Indo-Gangetic plain, there's a lot of alluvium. There's also a lot of alluvium in the Brahmaputra basin. But this alluvium may not always be a suitable or ideal site for riverbank filtration due to various hydraulic conditions, which I don't want to elaborate in too much detail now. But nevertheless, there is a lot of unexplored potential. But what is also more important is that you are all aware of the Jal Jeevan Mission of the government of India and of our Honorable Prime Minister. And the aspect of the concept of managed aquifer recharge and riverbank filtration, they play an important role in the source sustainability. And source sustainability is one key aspect of Jal Jeevan Mission which has to be considered. And this concept of a master plan, which would be required to implement riverbank filtration on a larger scale in the country, was initiated already nearly 10 years ago, and a lot of design and operation, water quality aspects, and site investigation procedures are included in this. And to find out exactly how we should go about with this, we did a questionnaire survey, and we found that it was in order to propagate or to make better use of RBF in the country, it's more important to inform the government agencies, the state government agencies, also to organize visits to demonstration sites, which means that such demonstration sites also have to be constructed, and they must be made available to the public. That means the people have to be able to also see what's happening at the site, and of course also to organize training courses and to communicate the science and the riverbank filtration, also not only to the engineers but also to universities and also to students and the future generation. So most important is that one has to have procedures to identify suitable sites. That means most important is that your river is always in hydraulic connection with your aquifer. You should have sufficient thickness of sand and gravel, enough suitable hydraulic conductivity also, and of course you must manage the water quality. But you also need policy and planning aspects included, and of course that includes the government and the state departments such as PHEDs, water resources departments, and so on. And of course, we also need to train people on this subject. So it's not just we write the papers and just keep it there, but it's also important to communicate this to the stakeholders who are involved. So let's come to the first site, which I'd like to show you on the basis of the demonstration site in Hardwar. And what is important in Hardwar is, you would all know that a lot of bathing takes place in Hardwar. Now, Hardwar, many years ago, in the last 2 centuries, there were cases of cholera epidemics in Hardwar, and that was mainly because when people would bathe, they would take a sip of the water and they would get sick. And after that, they built such wells like you see in the left picture. These are large diameter casing wells, and when water began to be supplied from these wells, and people would only drink that water, then the cases would decrease. So the water supplier in Hardwar traditionally already decided that from a public health safety and from the perspective of providing sufficient volume of water, sufficient quantity in the desired quality, it's more effective to go by such wells than to build a conventional surface water extraction plant and to treat it conventionally. So in Hardwar, there are about 22 bank filtration wells, and these are placed on this map. And you can see that the arrows point to show the main flow of the water. And in the upper part of the left diagram, you see
more water or groundwater flow coming from the land side. In the middle, it flows across that island, and in the lower part, it flows from the upper Ganga Canal towards the Ganga River. So there's a natural crossflow of the Banksford, and the wells are located on these islands, and they receive a considerable portion of Banksford. And in the left picture, you see the time it takes for the water to reach. And in most cases, the time is more than 2 weeks. In many cases, also more than 50 days. And that means there's sufficient time for especially microbiological pathogens to be inactivated. And microbiological pathogens are the main cause of concern at this site because of all the bathing activity which goes on. And here, this diagram tells you how much is the contribution of the river water in the water which has been pumped out of the wells. And we see that in many of the wells on the right side, it's about 90%, even more. And the wells on the left side, it's less. And these are located in the northern part of Haridwar, which gets mostly groundwater, but that's not a problem. There is still, out of the total water which is pumped out, 40 to 90% originates from the river. So in this way, also you can see directly that your groundwater resources are also conserved to a certain extent, and that you're not only pumping groundwater directly, but it's a mix of groundwater and the water which is originating from the river. Of course, one can calculate this using some simple equations like the electrical conductivity. One can also calculate this using numerical groundwater flow modeling. We will not talk about that more now. But what's very important in Haridwar is the removal of turbidity. And turbidity is a precursor for pathogens. That means if you have turbidity, the efficiency of chlorination is less in the water if you try to chlorinate it. And then also the turbidity is very tricky for conventional surface water treatment plants to remove the very high turbidity we get in the rivers, typically in India and monsoon. So if you look here on the right side of the diagram is the scale for turbidity in the Ganga, and it goes up all the way to nearly 1200 electrometric units. And on the left side is the turbidity in the wells. And we see that mainly the turbidity in the wells is usually less than 2 NTU. However, for the Ganga, it can go up to as much as 1000. And the conventional surface water treatment plant, very often many of these plants have to shut down in monsoon because they just cannot remove such high levels of turbidity. But bank filtration can do a relatively good job. And that means that you bring the turbidity down to this level, then the effectiveness of chlorine is much better because the free chlorine consumption is then not so high when you disinfect it. That means that there's much less risk of waterborne pathogens being transported and very less risk of falling ill. This shows the removal for E. coli, which is a very typical indicator for bacteria contamination. And here too, you see that by and large, mostly for the riverbank filtration wells, it is low. It is not zero because sometimes they do not completely get removed by bank filtration. And that is why one needs disinfection afterwards to remove whatever might be left. And this picture shows it a bit more clearly. So this was over many years. At certain intervals, we did some monitoring. And this is for all the wells taken together. And we see that the one count per 100, the one count in most probable numbers per 100 ml is the detection limit. So mostly no coliforms were detected, no E. coli was detected, which is a positive thing. In some cases, of course, it was detected. And also for the Ganga River, which you can see it's quite high. So motivated by this, the water supply company of Uttarakhand Jal Sansthan was motivated also to develop riverbank filtration further. So in Haridwar, the first well was built in 1965. And after around 2010, there was a push to to develop new sites in Uttarakhand. And at these sites, which are listed in the table, from Srinagar to Satpuri down to Bageshwar, new RBF wells were constructed. And these were funded also by the Department of Science and Technology. So this was a nice example where they funded an applied project also to try to demonstrate it and to also include engineering companies, consultancies, well construction companies, the water companies, and so on. And one site which was where the water supply was problematic is Srinagar by the banks of the Alaknanda River. And at this site, they were going to build a new tunnel, a new water hydropower scheme. And you might be aware, hydropower schemes, especially in the hills states, have come up in a very big way. And they require usually the diversion of water or otherwise the storage of water to run the turbines. And they would have built a tunnel. Across in the upper picture on the left side. There's a straight line you see, and they would have built a tunnel through the mountain, and that would have reduced the flow to the conventional water treatment pump. That means there would have been less water to pump out from directly from the river, and that's why the motivation was to build a RBF well, and that was done in the right picture on top at that side. And this is how it looked like. And this is where also Dr. Longam, he worked on the site, he did the investigations, the design of the wells and so on. And you do not see them right now so clearly, but you can see a few boreholes sticking out. And then came the big flood of 2013, which many of you might be aware of. And this flood completely inundated the site, and water also entered all these wells. So there was also a lot of sediment which was deposited. That green circle is just a landmark there, just to identify the site from the previous pictures. But otherwise, you can see how much sand was deposited, and the sand went into the machinery, into the wells. And basically, this site had to be then redeveloped. And even, one sees that even after the flood water receded, the bacteriological count in the river water with 744 mpn for E. coli was less than what was found in the groundwater wells, where it's much higher. And this just shows that bacteriological contamination in the short term is far more critical than other contaminants, and that they can survive also for a very long time. And that's why it's necessary to try to make the wells flood-proof, or to try to prevent the entry of water, direct surface water during floods into your wells. Because if you can do that, then even during a flood, you can try to provide safe drinking water. And so with that, this site in Srinagar was redeveloped. Subsequently afterwards, the big flood, and we see a few black dots. So there are 3 black dots, numbered 1 to 3. Those were the location of 3 new RBF wells. And on the land side, we see a few more dots. In total, there are 7 wells. And of course, these 3 dots next to the riverbank, they pump out the most water. And one flood-proof riverbank filtration well was designed there. So the flood-proof well head was designed. I don't want to go into too much detail here, but basically, the flood-proof well head is put where the well protrudes out of the ground at the interface of the ground surface. It is there, and it prevents direct entry of the surface water. But of course, you don't have only surface water coming in, you also have debris in the river. You can have trees floating, you can have during a flood even stones, maybe cars or something floating down, and to prevent that, to provide more safety to the well, you make a chamber, which you can see there, that concrete block. And of course, also embankment was built there. And basically, if one try to also fit out the well with flood-proof hatch, so to prevent a watertight cover, chamber cover, and also to seal all the annular spaces. So you know, it might seem like maybe mundane engineering aspects, but these are very critical aspects. So So as an engineer, many of you are studying engineering. This is where these points become important, yeah, because after all you're creating infrastructure and you want your infrastructure to last. And also where the cables go into the well chamber and go into the well, down into the submersible pump, the cables of the submersible pump, they were also then special seals were used also for that. So finally we were able to construct this well and we tested it and it was no watertight, so no surface water could enter into this. So that was a nice thing also. And there were some places where the thickness of the alluvium was insufficient, and there the water supplier built caisson wells or large diameter caisson wells because you have a large storage capacity of water, and so basically you're compensating the depth with the diameter of the well, and this was built at some other sites, so not every site had vertical wells, but also caisson wells, like Professor Grishek explained. And finally, these sites, yeah, they were developed nicely. They also introduced the concept of boundary walls around the sites because in Haridwar, for instance, sometimes there are no boundary walls around the well, and that's why a lot of anthropogenic activities like bathing, defecation takes place around the wells, and this can contaminate the water in your well. So to prevent this, they also did this. And the question which is always asked, so what is the use of all this? I think one very important aspect is that through the construction of these new wells and the scheme, one was able to provide more drinking water also to the people. That means one reduced the water shortage, one provided high quality water, and consequently also the per capita water availability increased as a result of these measures. So even if you think that and the idea just is to motivate you because a lot of engineers on site worked also on these projects. It's a nice example also to show that there is use and it is societally beneficial, the work that you all do also. Yeah. So now I would like to come closer back to you slowly and to round up the circle. And I would like to take you to a small village called Dakhin Pakur. Dakhin Pakur is, some of you might know it, it's northwest of Guwahati. It's on the other side of the Brahmaputra River. And there, the idea was to demonstrate this technique of back filtration in the northeast. And it was very difficult to find a suitable site because first we looked in Guwahati on the south bank, so on the left bank of the river, and there was a lot of silt there. There's so much silt deposition that the silt acts as a barrier to flow from the river to the more coarser material beneath. Yeah, so that's why we had to look at this a different site, and at this site we have this in the lower left picture, the well. The well, it's located approximately around 30 meters away from the river, and the water is pumped out. It goes through aeration, and after the aeration, it goes through a rapid sand filter, and lastly, it is chlorinated. And this scheme is also being, it's part of the Jal Jeevan mission. And if one looks at the water now, one can compare the river water with the water which is pumped out of the well at the site, and one can compare it with landside groundwater. And we see that from the electrical conductivity, which is a sum parameter, it is more closer, or just about 100 microsiemens more than the river water, whereas the groundwater has a much higher mineralization. So we can say that we get an indication at least that this well is pumping a greater percentage of river water probably as compared to groundwater. Also, we see that other critical parameters, for instance, like arsenic, it's practically not detectable. Yeah, it's very, very low. And iron is also lower than, for instance, ambient groundwater. Yeah? So we can say this is also one positive aspect. And of course, the dissolved organic carbon is also relatively low, not extremely low, but it is at least 50% lower than in the river water. However, one critical aspect here also is the presence of microbiological or bacteriological indicators like E. coli. You still have it in the well water, and that is why, of course, you require disinfection. And the novelty in the project that we are doing, the CCRBF project, which was introduced by Professor Grishik, the previous speaker, was that earlier they were using conventional chlorination. That means sodium hypochlorite was being dosed with the pump. However, very often the pumps break down, the dosage pumps. And the idea was to try to be able to provide a standalone system, and which is more maybe robust. So for that, our small medium enterprise partner from Germany, they built a on-site chlorine generation plant. And the principle in the on-site chlorine generation is that with the help of a sodium chloride stock solution, hypochlorate is produced, and this hypochlorate serves as the disinfectant then for the bacterial for the pathogens. And all this information is then transmitted also to Germany, to the company, through an Arduino system, and also through the help of the SIM card, and also the flow velocity and the flow rate, everything is communicated, and they are able to accordingly adjust also the dosage of the chlorine. And if we look here, we can see that for different different chlorine dosages can be set for the system. So one can have 4 liters or 400 ml per hour chlorine dosage. One can even have 600 ml per hour of chlorine stock dosage. And that even when you increase, because the dosage is proportional to the flow rate, and even if you increase the flow rate, then you can still have a sufficient amount of free chlorine available to disinfect the water. So this is currently being tested right now. So we can conclude also that at least in Haridwar, it's a sustainable system there. There's no long-term depletion of the groundwater levels. And also it is good to useful to buffer high water demands. And at the bank filtration site in Guwahati, there are suitable hydraulic boundary conditions. That means we have a river all around the site nearly. Disinfection of the well water is required. Otherwise, by and large, it's good water quality. And it's also an example where one can demonstrate the source sustainability within the Jal Jeevan mission. And of course, there's a large potential also, large, but I would say unexplored potential for bank filtration. So maybe it's a motivation also to there's also a lot of potential and scope to do more work in this field. And with that, I would like to also thank everyone. Most of all, I thank all of you for being here. Maybe it's the largest audience I've ever had. Thank you very much. And I'd also like to thank Dr. Longang for his support, untiring support, and also his student Fazlur, who's very often there on the site. All the partners, and I'm also happy to say that yesterday the water supplier visited the site and he was able to inaugurate the new on-site chlorine generation plant, and one also has provided some information at the site. In the you can see a board at the background, and so basically the efforts also of Dr. Rongang have gone into this project, and we've tried also. So it's a nice example where I would say the local, you as a local cumulative strength are engaging in this project. So thank you very much, and with that I'd like to conclude.
Thank you so much, Dr. Cornelius. It appeared to me Dr. Cornelius is very humble, very calm today. No strict, किसी को कुछ काटा-वाटा नहीं है. Probably आज हमें बोरलैंड से बहुत प्यार है, इसलिए पूरा प्यार ही प्यार आ रहा है. तो maybe I can have few questions, at least 2 questions. So anybody would like to have any question? कुछ सवाल पूछना चाहते हैं? RBF क्या है? आप क्या कर रहा है? किसी को कुछ सवाल है तो हाथ उठा सकते हैं. मैं आपको माइक हैंड ओवर करता हूँ. कोई इंडिविजुअल जिसका कुछ जानना, कुछ बातचीत करना चाहते हैं? मुझे लग रहा है कि आपकी जो कामनेस सॉफ्टनेस है सबको समझ में आ गया। तो कॉर्डिनेस एक चीज बताइए, जो आपने हिंदुस्तान और जर्मनी में दो पहलू रिवर बैंक प्रिवेंशन पे काम किया है, तो आपको कैसा महसूस हो रहा है कि आप जब दो अलग कल्चर और दो अलग टेक्निकल पॉसिबिलिटी और फिजिबिलिटी के बीच में काम करते हैं?
तो आंसर हिंदी और इंग्लिश?
आपको क्या चाहिए, कौन सा लैंग्वेज में चाहिए? क्या जापानीज? इंग्लिश सर, इंग्लिश सर।
Okay, so the question was, from my experience, what is the difference between working on riverbank filtration, like doing field work and all in India, and compared to Germany? So I think it's all, both are extremely exciting. In India, it's a bit more challenging because one has to organize a lot of things, but on the other hand, there's also a lot of support in India. Now, from right down from the inhabitants who live at the site to the water supplier, so everybody is very helpful. Now, of course, in Germany, people are also helpful, but in Germany, things go according to a very usually rigid kind of a checklist where you have to make all the arrangements before, and there's very little room then later on for error, because you cannot go again if you've forgotten something because it's just too expensive. And whereas in India, okay, if you forget something, you can of course repeat it also, but even otherwise, if something is missing, one can organize things also. There is always possibility and there's more flexibility maybe.
Sir, I have one question. I have just now talked with Rohan sir regarding this RBF, especially in BDC area. So, is it necessary to establish this kind of RBF? Do you think it is necessary, or regarding that only, sir, my question: is it necessary to establish such kind of RBF in BDC area? That's my question, sir.
So it's always let's put it this way. RBF, the beauty of RBF is it brings many different subjects together. So you have hydraulics, you have chemistry, you have numerical modeling, you have geophysics, you have hydrology. But to bring all this together, you need a lot of competence. So this competence comes only through experience and through training. And if one creates a center or a central location to develop this competence, then this competence further has a multiplicator effect to train not only higher education institutions, the students, but also the water suppliers and the industry in the regional context. So we had created a competence center in Roorkee with NIH, but it is too far away. And if you create something here, it's much closer and it directly benefits the region much more than if something is located too far away. So I'm not completely for centralizing everything in one location in Roorkee. It's much more effective to have different locations where also the competence is simultaneously being built, because after all, India is a very large country.
Thank you, sir. Okay, thank you, Dr. Sandhu. I now request our volunteers, and I request Professor Manmohan Goswami to hand over the gift. So we are just almost coming to the end of this today's lecture series, but I take this opportunity to thank all the speakers, all the dignitaries, other dignitaries coming here to attend this session, and the participants. And before going to the end, I now request Professor Manmohan Goswami, Professor, Department of Civil Engineering, CIT, Kokrajhar, to just sum up today's lectures, because he is the co-chair, and I give the responsibility to sum up these lectures today.
Good afternoon, everybody. It was a wonderful session, and so much of knowledge delivered in like so little time. I think we could have given more justice if we could have given more time, perhaps one session for one speaker, because it's so much, versatile, so much like a wide area with each one. Now, particularly, I think I don't have much time. I said this briefly. I have to summarize. Regarding the first talk, if I see like from the context of Northeast or board, and there I see loads of prospects of gathering more information from the plants and the naturally available medicinal theories like what people here use, and those can be beneficially extracted and then produced to for the betterment of this medical sciences for those diseases which are not, for which we do not have really cure these days. Now, but still, my one personal opinion is that whatever we do, we use very we produce very artificial products at the end. Like base is natural, all right, but we ultimately make it kind of too much artificial. I don't know how effectively will it act to target the disease cell or the protein, but it may have impacts on other proteins which are good or other cells nearby, like which could have acted better if there was some natural coating to that protein. Like we are extracting the protein, we are discarding all the natural parts which were part of that protein. So I think we have to. It is good that we can extract, but then still we have to think about combining it with some natural components of the plants or medicines from which we are collecting those. So that way it will be more receptive to the body rather than making harm. Then coming to the riverbank filtration, which is covered by three eminent speakers, world-known speakers, I see the prospect in this particular region as very high, but I would love to see some discussion on cost aspect, because what I find is that this particular technology can be a good work or good technology for this, what we say, conjunctive use of groundwater and surface water, because in most of these parts we use groundwater. The managed surface water supply is very less. Even in Guwahati is having like majority of the population survives and depends on groundwater. Households, even in industries everywhere, and the quantum of managed source of supply is very less. Even Brahmaputra water is supplying like bringing so much water, but the quantity of water that you extract or pipe supply, surface water supply is very meager. So they're combining the groundwater and surface water, and so that you can reduce, as we saw in the last presentation, like groundwater has got certain elements which are very high in concentration which you do not want. Surface water has some other components which are not very attractive for potable water at different seasons. So if you do some kind of analysis, seasonal analysis, and depending on the seasons, if we can mix the groundwater and surface water, it is the same source. Basically, we are mixing some groundwater, some surface water, so we can I think manage the water supply in a better way through this RBF technology. And main problem is costing. So if we can show that the water supply networks which use surface water broadly, that requires maybe more cost for treatment before it is supplied. Now, if we use RBF, if the cost reduction is there, and if we can project that to the decision-making authorities, perhaps the acceptability will be more. So in this kind of presentations, if you can show some comparison between like the cost, if we directly pump water from the surface water sources, and if we use RBF, what benefit we can get? And that will be, of course, the other benefits, the filtration benefits, the controlling pollutants, those benefits are there. But ultimately, it trickles down to the cost. So if you say, like, if I ask some households to get RBF technology, he or she will not be interested in doing that. So, but then at decision-making level, if you want to implement it, I believe that it will be beneficial for the costing OPEX part, particularly. During operation, like during construction, it may be almost costing similarly as it would cost a direct water supply from people. But on the side of OPEX, I think there will be long-term gain. So that way, I think the revenue, the revenue calculation could also be, kind of an attractive solution, attractive to the decision makers. So I would suggest that if you happen to like give this kind of lecture, this part, if you can show some kind of costing part, like benefit that you can derive from installing RBF vis-a-vis directly pumping surface water. So that is what my observation is. Otherwise, the lectures were very good. The techniques were very nicely described, and we could guess the benefits that we could get from installing this RBF and using this RBF technology in garden also. There are problems of groundwater pollution, and I think that would be highly beneficial. So these words, I would thank the speakers and I thank the organizers and to the audience as well. So over to you.
Thank you, sir.
So we have come to the end, almost end. As we know that we have a very illuminating lectures, so we are much benefited from the embedded talk given by our resource persons. To make this event successful, one more factor is there, that is the conducting of the event. So our two chairpersons, Professor Bailing sir and Professor Goswami sir, they conducted the event very nicely. That's why the event was very successful. Now, I would like to offer a certificate of appreciation. So for that, I request Dr. Kamal Brahma sir, Principal BB Engineering College, to hand over the certificate of appreciation to Professor Bailing sir, Chairman of today's event. Next, I would like to request Dr. Madalisa Ramhan to hand over the certificate of appreciation to Professor Manmoy Goswami from CIT Kukrazer. So, thank you. Now, I request all the resource persons and associated with this event to come here to have a group photograph.
So all the organizers, participants, delegates would like to invite over the stage, please, so that we can have a group photograph. Sir, for a group photograph. What is it? Yeah, perfect. So thank you so much, everyone. And all the participants, thank you so much. Taali bajao, yeah, last. Okay.